Thank you so much, Dr. Sallis. We've got a couple minutes for discussion at this point, then we'll take a short 10-minute break. We also will have time at the end of the day for a wrap-up with Dr. Sallis as well. So are there any questions right now? There are a couple mics around the room.
Yeah, since we're recording this, please use the microphone. So any questions that are things that are unclear, or if you have some ideas about how you might want to implement some of these ideas or strategies or principles, be happy to hear about that as well.
I guess one question I had was, I've had, in lead up to this presentation, I've had several people say, oh, I know Dr. Sallis. I go to his website all the time because he has all of his measures available for free online. Do you want to talk a little bit about that and what might be some important ones for people to look for?
Well, we have many measures related to activity, many related to nutrition as well. Some of them focused on kids and schools. And we have all the information, whether it's physical activity measures or environment measures, or people have been using our self-efficacy and social support, more psychosocial measures for a long time. And I just decided to put them on the website many years ago because it saves me a lot of time. People don't have to ask me, can I get your measure? It's just there. And so we have even more measures on the Active Living Research website, including, as I mentioned, the environmental assessment for rural communities. We have both an observational and interview measure and a self-report measure. So they're just about activity environments, but those may come in really handy.
And do you need a PhD to use them?
For most of them, no. For most of them, no. Some of them are a little complicated. The observational measures, you need some expertise to really use those well. But the Maps Mini, it's so short. I think it's really simple. We have a manual with the photos and definitions of everything. There's only 15 items. And we actually designed that for non-researchers so that community organizations or practitioners in city planning or wherever, or parks, could use those measures. So they should be really easy to do too.
I serve a lot of the population that you've shown in the last study. The research does not hold up for that population. What's the data on research that does? Because we serve a lot of that population here in Kansas City.
Yeah. I think these were community-wide programs, so I can't really say, well, what's going to work with the highest risk communities? Because right now it's just showing us that things that people are doing now, even working within, if it's let's say it's an all, predominantly African American or predominantly Latino community, they're doing similar things that other communities are doing, and it's having less effect. So, I would say that I mentioned the concept of equitable differences. And maybe you've seen some of the illustrations of what equity means. All right, so if people are trying to look over a fence into a baseball game, giving everybody the same size box to stand on to look over the fence doesn't work if you're this tall. Okay, so that the person that's that short needs a bigger boost, and so that may be what we're looking at here, so that in otherwise disadvantaged communities, we need to be looking at making more investments, about more community involvement, to making sure that we're addressing the problems that are affecting and of concern to that community. So I think we have some hypotheses about what we could do that would be more and more targeted, but I guess we don't have the evidence of really what it's going to take. So that's kind of, it's a big next challenge. That's a challenge for all of us. And so I would say this is a great opportunity for groups like this. If you're working you have a community coalition to collaborate with researchers to evaluate it, because you may hit on the right combination of strategies to really make a difference. And we want to make sure we learn from those things. So whether you work with a researcher or not to evaluate it, do some evaluation to see if it's really having an impact. So I think we can't assume that we're having an impact in the communities at most need for these types of initiatives, but that's what we need to work on.
Dr. Shook, do we have that coalition at Children's Mercy yet?
That's a Shelley.
Thank you so much.
Thank you for your question.
And actually, I'm glad you brought up the Healthy Community Study, because tomorrow during one of our sessions, we've got Vicki Colley-Akers and Stephen Fawcett will be presenting in quite a bit of detail on the Healthy Community Studies and expanding on what Dr. Sallis showed. I've got just one final question. Do you have any excellent examples of communities or even neighborhoods within communities that have made really dramatic changes for the better to improve the environment?
Oh, yes. There are things going on all over the country. You know, I would, for big cities, of course, maybe this is irrelevant for most, but New York City just transformed itself in a lot of ways. If you've been to New York City or you go soon, bicycle there, because it's now much, much safer than it used to be. My home state is Mississippi. And so I point to Hernando, Mississippi, which is just south of Memphis. Had a mayor, said, I'm going to be the health mayor. I'm going to make my town the healthiest in Mississippi, the least healthy state. All right, so trying to do the right thing, and made a lot of changes. Spartanburg, South Carolina, has a foundation there that's been working on making it healthier for active living and healthy eating and reducing disparities. So they're making a lot of changes. They've got a big partnership there. There are really communities all over the country, many of them supported by foundations, because if it's really at high risk, that means of obesity, that usually means they don't have a lot of resources, so there needs to be some new resources in there. So there are really communities all over. And you know, I've heard of small towns in Montana and Wyoming, and you know, mayors talking about we're reclaiming our downtown and making our main street walkable and slowing down traffic and bringing people back. And a lot of times, the city leaders are not doing it for health. They're doing it for economic development and economic revitalization. But it turns out that they're the same things, because people want healthy communities. They want places where they can walk. They want places where their children can safely bicycle. And so people want and desire those places. And the other thing is, not just the current residents, but the mayors are saying, yeah, we make our city healthier, and new businesses want to come. You know, companies will want to relocate to us. Oklahoma City is a really famous example of that. A big company was thinking about coming there and decided to go elsewhere, and so the mayor called up the head of the company and said, why didn't you come here? Well, nobody wanted to live in your city. And so now they've taxed themselves. One of the most Republican states has taxed themselves repeatedly to put in parks, to put in bicycle facilities, to put in pedestrian facilities, sidewalks. So it's really happening all over the country in places big and small.
That's great. Let's give him one more active applause.
Thank you. You've been very patient with me.
And we'll take a break and meet back at 10:25.